Well, it's time now for Health Report, and joining us now is Africa 54 health correspondent Linord Moudou with some grim news for the residents of South Sudan.
The United Nations World Food Programme has issued a warning that hunger in South Sudan may double due to drought and a collapsing economy. At a food distribution center in Arroyo, northern Bahr el Ghazal, World Food Programme nutritionist Felista Busi tests women and children for malnutrition. A reading lower than 12 indicates severe malnutrition.
This is a girl, and she is 2 years old, and she is also severely malnourished. The MUOC is reading 11.
The World Food Programme warns that more than 5 million people may go hungry in South Sudan. WFP says despite attempts to end the civil war that has devastated the country for more than 2 years, a collapsing economy and erratic rainfall are contributing to a growing crisis. Those who can are moving on.
I'm living with anger and sadness because hunger is forcing me to leave my homeland. Your homeland is your homeland. If there was something to eat, I would not even think of leaving.
Markets are still open, but in some cases, prices have doubled. Some people rely on aid from WFP. The organization says it urgently needs more than $200 million over the next 6 months before the rainy season starts, making many parts of the country inaccessible.
We're scaling up our response in this area so that we can be able to cater for these people. It is a process that we're beginning, and it's something that needs a lot of support, and we are also therefore calling on all our donor partners who have supported us this far in the past 2 years since we had conflict to come even more.
2.8 million people have been already classified as in crisis or emergency. About 40,000 are thought to be suffering from an outright famine. Joining us in the studio for more on the situation in South Sudan is Silke Pietzsch, Technical Director for Action Against Hunger, a global humanitarian organization committed to ending world hunger. Ms. Pietzsch, welcome to the show.
Thank you. Thank you so much.
So let me have your reaction to the report. Your organization is working on the ground in South Sudan. What is the situation there? What can you tell us?
Yeah, so the situation we see is very dire. South Sudan has been on our radar for a long time now. We come together with a number of humanitarian actors in country on a regular basis to exchange information we have gathered, to look at where the gaps are in the country. So we see about 5 million people who are in need of humanitarian aid. We see at least 3 million people who are already now in severe hunger crisis. So we're very concerned about those. We're very specialized at Action Against Hunger in undernutrition. So we're concerned about the children under 5 years of age, pregnant and lactating women. We see 1 out of 4 children being acutely undernourished at this point of time with an increasing tendency. So we're very, very concerned, and there is an immediate need for action from the humanitarian community to step up and scale up the response we're able to deliver on the ground.
So the immediate need the immediate aid that is needed, you talk about scaling up. In what area we see that there is the hunger and drought? What area needs to be addressed, really?
So overall, South Sudan has multiple kind of crises in itself going on at the same time. You can see the western side of the country is very much in chronic crisis. For many years that we've been trying to support the recovery from the past kind of war, etc. The main focus on the acute emergency now is really on the eastern parts, northeastern parts of the country, where there's still active fighting. And one of the key problems or challenges we face is access to those areas for the humanitarian responders. We're not able to go there, we're not able to see what are the needs, how much of the population is in what needs exactly. So as long as we're not able to get there, it's really hard to define the needs and be able to deliver on those needs appropriately.
But you're working on the ground, so what is Action Against Hunger able to do at this point?
So at this point of time, in the northeast, in the acute crisis, we are working on the treatment of undernutrition, focused on children under 5 and pregnant and lactating women. We're supporting the coordination of the camps and settlements of internally displaced people, well. We're working on food distributions, we're working on water and sanitation to provide the minimum needs. There's lots of additional needs in terms of mental health. People have gone through trauma, there's displacement. So we're very concerned about the overall situation and well-being of that population in terms of not us only getting there, but as well being able to respond to the large scale of the needs. We're talking about 3 million people. That's a lot of people to kind of support acutely and immediately there.
That's a lot of people. And quickly, as we look at specifically undernutrition and malnutrition, what other issues must also be addressed to ensure that as patients recover, you know, they have a good well-being?
Right. So at Action Against Hunger, we look at undernutrition as a holistic problem, if you wish. Undernutrition doesn't exist just in itself. It comes out of a problem with food, with care practices, with water, with diseases. So we're very concerned, especially at this point of time. We're moving into the hungry season. Food will get scarcer and scarcer. We're moving into the rainy season. Waterborne disease will come up. We will have a lot of diarrhea. We will have an increase in malaria. Yes. So we're very worried about the confounding factors that are contributing to undernutrition. So we can treat the child at the center, but if the home and the living situation haven't changed or are getting more and more concerning, we obviously are afraid we're having the kids come back to the nutrition center as well.
Okay. Okay, we have to leave it there, Ms. Pietzsch. Thank you so much for joining us.
Thank you.
And that was Silke Pietzsch. She is Technical Director with the global humanitarian organization Action Against Hunger. That's our health report for today. To stay in touch, find me on Twitter at Linord Moudou. Vincent, back to you.